So, anyways, final conference in the series for Gautham this morning. So, and for the guys. Anyways, just grateful for these guys and all the work they've put in all year. And I think this is a great talk to end on, which is you made it through, right? And in some ways, it has a lot to do with your all your innate abilities to, in some way, shape, or form, become Stoics. That's what kind of this whole 6-year journey is for you guys. So, and you're still in the middle of it. That's all right. But anyways, Gautham is, we're excited to have Gautham here. He's off to bigger and better things back in San Antonio and going to do a great job out there, joining a pretty cool practice. So we're sad to see you leave, Gautham. You've been the butt of a lot of jokes, and you provided us with a crazy amount of laughs and humor. And thank you for all you've done for us, our patients, and it's really, really valued. So, anyways, without further ado, Gautham, teach us a little bit about Stoicism, and a great intro for this weekend too.
Yeah, that's
right. So it's really good for bridging the gap and hear a little bit more about this.
All right. Well, thank you, Dr. Mundis. Yes, it is the last couple of days of fellowship, and so I thought we'd round it out with some parallels between life and Stoicism. Recently we were at the Spine think tank meeting in Cabo, and Todd Albert out of HSS kind of brought up out of talk with his parallels into Stoicism and how it affected his life, and it kind of brought back this stuff for me. And for me, it kind of all started here at this small school in Sherman, Texas, and this is actually Austin College, a small liberal arts school, where actually me and my co-fellow Tim first met and somehow ended up here together in fellowship. But here at this institution, sometimes you're required to take some random classes, and like history, religion, philosophy, and things of that nature. But I didn't really fully internalize some of these lessons until several years ago when I was a junior resident. It was at this time my aunt suddenly died out of nowhere from an undiagnosed brain aneurysm that ruptured. She left 2 young kids behind, and there was a lot of questioning about why this, why that. And that kind of led me stumbling upon something that I was introduced to at this very place here, and that was Stoicism. So as I leave here, my final days of training, I wanted to share some of the things that got me through it all, but I think it's important to first know a little bit about the history, and that part can be a little boring, so hang with me here, and we'll get to some fun stuff. So many centuries ago, you may see this guy, Zeno of Citium, and he was a merchant who was doing very well until a shipwreck destroyed him, and he lost everything he had. He made his way to Athens and made his way to this bookshop where he was reading a bunch of books and eventually came across this one, Xenophon's Memorabilia, which is about Socrates. He was so fascinated and asked the bookseller, hey, man, where can I find one of these philosophers? And of course, back then, there were philosophers left and right. And so anyway, the bookseller pointed him to this guy, not the best looking guy, but his name was Crates. Okay, so Crates introduced him.
I feel a new nickname coming on.
Nikita. So Crates
What's mouth?
introduced him to philosophy. And Zeno went on to study a lot more different schools and thoughts, and finally established his own school, which became known as Stoicism. So Stoicism arises from the word stoa poikile, or painted porch. And basically, this was an open market for people to talk about life and how to make it better. He believed, they believed that by changing the manner in which people thought about life's events, they could detach from negative and harmful emotions, reducing suffering and improving their lives. So for Zeno, it was not so much about what people made of it as much as they thought about it. So now, while Zeno was a founder of Stoicism, it was one of his followers, this guy right here, Chrysippus, who would become one of the most influential of the Greek Stoics. Although none of his works remain today, Chrysippus is thought to have authored approximately 700 works and is widely considered the greatest ancient philosopher behind Socrates, Plato, and Aristotle. So the philosophy made its way through the Hellenistic world first, and then eventually made its way to the Roman Empire. And actually, most of our knowledge of Stoicism comes from the writings and ideas of these Roman Stoics rather than the Greeks. Important Roman Stoics include Seneca, who was a senator and a playwright, and he actually influenced Shakespeare. Musonius Rufus, Epictetus, who was a slave, and Marcus Aurelius, who basically wrote this Meditations, who you all may have heard of. Meditations was basically his own personal diary that he never intended to publish, but is now read by millions of people around the world. And it's interesting because here's a guy who controlled the largest army in the world. He could kill, murder anyone he wanted to, had all the money, but ultimately he was writing these things of daily struggles, daily problems in a journal with no intention of anyone ever reading them. And the crazy thing is that we shouldn't really relate to these readings or these writings at all, but we do. And that just kind of goes to show the universal nature of being a human. You know, people are people, whether it's thousands of years ago or today. So Stoicism, like all ancient schools of philosophy, eventually died down with the rise of Christianity, but it kept influencing people throughout the following 2 millennia. So enough about history. What exactly is Stoicism about? Well, it's basically based on a crucial premise that we should all live our life according to nature. So what does that mean? Well, here's a quote from Zeno. When a dog is tied to a cart, if it wants to follow, it is pulled and follows, making its spontaneous act coincide with necessity. But if the dog does not follow, it will be compelled in any case. So it is with men too, even if they don't want to, they will be compelled to follow what is destined. So what is he saying? Well, it's like a dog tied to a cart. You can fight against the pull, but in the end, you just have to follow. It's another version of Nietzsche's amor fati, or love of one's fate. Basically, it'd be in your benefit to go along with wherever fate, God, or the universe is leading you, as fighting it is essentially useless. You're going to end up going there either by choice or by force. Nature doesn't really give a crap whether you live in accordance with it or not, just as the driver of the cart does not care if the dog trots along happily or pulls and fights at the leash. Either way, the cart is going to go where the driver wants. So if you live life in accordance with nature, roll with the punches, and follow what the playwright has in store for you, you may find yourself a little happier. So there's 2 pillars of Stoicism. One is the 4 cardinal virtues, and that's practical wisdom, courage, justice, and temperance. Practical wisdom is the knowledge of what is good for you and what is not. Courage is not just physical, but especially moral. It's the courage to stand up and do the right thing. Justice is what tells you what the right thing is, how to interact with other people, how to treat other people. And temperance is the idea you should always do things in right measure, never overdo or underdo them. So if we translate these concepts to surgery, we can kind of break them down again. So wisdom is predicting complications and managing comorbidities to avoid downstream complications and ultimately protect our patients from disaster. Courage is something we do each day. We do this job. Spine surgery, without a doubt, is one of the most technically challenging and high-risk surgical subspecialties in all of medicine. Yet we thrive in this environment and enjoy it so much we dedicate our lives to it. Justice is treating every patient like they're your mom or your dad. It's letting go of any bias and caring for the individual, no matter if they're a prisoner or a billionaire. Temperance is keeping cool-headed when crap hits the fan. It's calmly navigating through the chaos of a complication, which ultimately may save your patient's life. So the second pillar is called dichotomy of control. And this is the very basic idea that some things are up to us and other things are not. And honestly, you can divide just about anything you do into these 2 categories and only worry about the former. So in summary, you can control your thoughts, actions, and values. You cannot control other people's opinions, outcomes, or external events. So focus on energy where it really counts. And here's a simple algorithm I like because it really just simplifies life. You know, next time you find yourself upset about reimbursement, how long turnover is, or how your circulator is moving like a snail, you can kind of go through this algorithm and ultimately it leads to just don't worry. So here's another important concept I'd like to share, and that is premeditatio malorum, or anticipation of misfortune. Just as we rehearse the steps of a procedure so that it goes smoothly, we also have to anticipate and visualize when things go south. We can't flounder or panic in this profession we've chosen. I think that's why I've been very grateful to train here. Each attending has had a critical role, and operating with the beast slack and facing his wrath has made me a little less reactive and taught me to stay cool and operate under pressure. And for those of you that don't know, this picture was taken after Tim's most recent ACDF.
The GI bleed.
That's
I'm thinking about the right level.
All right. Just kidding. Tim's awesome. So here, and another thing is choosing the hard route. That's what the Stoics do. Never really take the easy route. And if you think about it, in training, it's those tough trauma call nights where I've grown as a surgeon and learned how to delegate and lead when we've had multiple reductions waiting in the trauma bay. It's been those difficult conversations, maybe telling that 23-year-old girl and her parents she's paralyzed after a car accident, that has stuck with me and made me a more compassionate and caring physician. It's the hard things that remind you why what we do is so important and to never lose sight of that passion. So taking this all together, I think we can summarize some of these important principles and how they relate to our daily lives in the OR and clinic. I'll leave you with some relevant quotes from thousands of years ago that still apply to this very day. So dichotomy of control, as I said previously, Epictetus taught us that we must distinguish between what is within our control, our thoughts, choices, actions, and what lies beyond it. So other people's behavior, outcomes, and external events. And in surgery, as surgeons, we often carry the burden of perfection. But despite meticulous planning, flawless technique, outcomes are sometimes dictated by variables beyond our control, like patient comorbidities, biology, or just pure chance. What is in our control, and what Dr. Mundis has drilled in us this year, is how we prepare, how we operate, and how we respond. Did I double check the positioning? Did I communicate clearly with the team? Did I make the best judgment with the data at hand? Stoicism encourages us to master the process, not the result. When we do this consistently, we protect ourselves from self-blame while holding ourselves to the highest standards. So the quote I'd like to leave you with is, do your part with excellence, let the outcome be what it may. So virtue over ego, basically striving for excellence, not applause. Well, virtue in Stoicism means moral excellence, honesty, justice, humility, not self-importance or performance for applause. The Stoic seeks to be good, not noticed. So in the OR, the line between confidence and ego is thin. Ego seeks praise, virtue seeks precision. And true surgical excellence isn't about who gets the most RVUs or the recognition at the podiums. It's about doing what's right, even when nobody's watching. So as I go on, I'll always remember to teach residents and fellows thoroughly with passion, apologize when needed, no matter who it is, and share credit with the team. Acknowledge my complications. The virtuous surgeon doesn't need the spotlight. They need the patient to get better, and that's enough. So I'll leave you with this quote. Waste no more time arguing what a good man should be one. And that's Marcus Aurelius. So memento mori, or sorry, that was in the way. Remember, you must die. So it's in surgery, it's that every case matters. Be present. Time is finite. So this is not to be morbid. Rather, it's a motivator. Remembering life is finite. Time is non-renewable. Stoics reflect on mortality to sharpen their focus and gratitude. Every patient deserves our full presence. Each operation is an unrepeatable moment in someone's life. If today were your last day in the OR, would you rush? Would you cut corners? Or would you cherish each move like playing an instrument? Likewise, your career has a shelf life. What legacy are you building? Not just in cases completed, but people trained, lives touched, mistakes owned. So be present, treat every patient like they're the only one. Don't defer integrity to the next time. And this quote from Marcus Aurelius is, you could leave life right now. Let that determine what you do, say, and think. So sympatheia or interconnectedness, remembering you're part of a team, we're all parts of a greater whole. Marcus Aurelius reminds us that we're all cells in a body, interdependent, not isolated. And no case is done alone. Even in the finest technical hands, they can fall short without the scrub tech handling the right instrument, the anesthesiologist, or even the resident handling retraction. We got to remember when a case goes well, it's ours, but when something fails, it's still ours. Hierarchy doesn't excuse disrespect. Stoicism teaches mutual respect and responsibility. And this goes back to a book by Jocko Willink that we've discussed earlier the year, Extreme Ownership. If you haven't read that book, I highly recommend it. But it's building a culture of, as a leader, always taking accountability and responsibility. And it's never anybody else's fault except yours.
One of the members of his team is speaking at our meeting, by the way.
Right? We talked about that.
That's cool.
That should be good.
Yeah.
So say thank you. Build a culture of accountability, not blame. Treat everyone like a human being, not a role. And remember, what injures the hive injures the bee. And lastly, self-discipline. So self-discipline is basically avoiding shortcuts and following everything with integrity. So discipline is freedom. It's the power to choose the hard right over the easy wrong and to stick to principle over convenience. Shortcuts are seductive, rushing a closure, rushing through a timeout, quickly glancing over an x-ray. But Stoicism demands we do what's right, not what's easy. Integrity shows up in those quiet moments, the checklist, the pause before the skin incision, the thoughtful documentation. Self-discipline is the foundation of trust in yourself and from your team. So the quote from Epictetus is, "No man is free who is not the master of himself." So Stoicism isn't passive. Actually, it's fiercely active. It's about choosing character over comfort, precision over praise, and discipline over impulse. In surgery, as in life, these principles make us not only better professionals, but better human beings. So you may ask, how do I start incorporating this in my life? Start small. Start with 5 minutes in the morning to reflect on the kind of surgeon and human being you want to be that day. Go out there, execute, and at the end of the day, spend another 5 minutes writing 3 to 5 things you're grateful for and run through things you did well or could do better. Another interesting one from the Stoics is voluntary discomfort. In the modern era, this could be cold plunges, taking a hiatus from something like social media or anything you enjoy, really. Or one of the things I've heard of is not using your dominant hand for an entire day. Whatever it may be, eradicating something you're so used to for even a day can remind you just how lucky you are. Finally, not to be all woo-woo, but if you can spend anywhere from 5 to 20 minutes a day in silence, thinking about nothing but your breath or a simple mantra, you slowly become less reactive and a little more open. We're very evidence-based here, and there's a lot of literature out there to support this practice. And we go to the gym, we work out our muscles, we cycle and run, work out our hearts. And it's just, why wouldn't we work out something just as important, if not more, which is our minds? It can be somewhere as easy as brushing your teeth while you're on a walk or in traffic. And I know from personal experience, it's not an easy endeavor, but certainly it's a worthy one. Finally, I like to think of surgery as a high-level sport with how much we plan, we study, and go fix spines on game day. So I'd like to share some modern examples of Stoicism. And Alex Smith actually was at the Center of Intrepid in San Antonio, where I trained, actually over at the Army Hospital. A lot of amputees from the Army and military go there to heal up. And actually, Alex Smith spent some time there and came and gave a really beautiful talk, just how it affected his physical health, mental health, and how he overcame this stuff and went on to actually go back to playing NFL level football. So he was a #1 overall draft pick in 2005, facing years of criticism as a draft bust. He was benched, traded, replaced by younger QBs, but he never responded with bitterness. He always kept a team-first attitude. And then unfortunately in 2018, we all know the catastrophic injury that occurred. He had an open tib fib that I think was initially plated and unfortunately went on to have multiple infections. I think he even got septic and nearly died. 17 surgeries followed, and doctors even considered amputating him. He was told he was going to never walk again, let alone play football. And yet, after 2 years in brutal rehab, even having to wear an X-Fix, he returned to the NFL in 2020, not just as a backup, but as a starting QB, leading Washington to the playoffs. He won NFL Comeback Player of the Year that year. And his quote is, "There were so many times I wanted to give up, but something in me kept saying, this isn't how your story ends." He controlled the controllables, focused on what he could, and ultimately displayed, what a Stoic should, and came back to playing NFL. We see Brady as well. He was drafted 199th overall. And instead of focusing on the, humiliation or unfairness of being a sixth-round pick, he focused on what he could: preparation, attitude, work ethic. And I think we all know just how successful he was. Tiger, he had a fall from grace in 2009, personal scandal, loss of sponsors, public humiliation, and it was a defining test. He could have just disappeared, but instead he owned his mistakes, he rebuilt his life, and he let that adversity fuel growth. Later on, despite multiple knee and spine surgeries, he went on to win the 2019 Masters. And then just a couple of years later, in 2021, he nearly died and lost his leg in a car crash. But yet he keeps on pushing, and he emerged from the car crash with a transformed mindset. Less obsessed with winning, more grateful for just being. And if you look at him and watching his son Charlie at different tournaments, he just seems so happy for the small things. And I think that's what Stoicism is about. Rewind a couple of years prior, and you have here Jim Stockdale. He was a Navy vice admiral and pilot and a strong student of Stoicism. He was a fellow prisoner and best friend of Senator John McCain, and his story is actually pretty extreme. In September of 1965, his plane was shot down as he led a raid into North Vietnam and was ejected into enemy territory. He said that he was shot down. When he was shot down, he whispered to himself, "I'm leaving the world of technology and entering the world of Epictetus," the philosopher that we were talking about previously. He had already accepted his fate. He was imprisoned for 7.5 years, during which he was repeatedly tortured, denied medical attention, kept in solitary confinement, and even cut his own face to avoid being part of a parade for propaganda purposes. He was the highest ranking officer in the infamous Hanoi Hilton prisoner of war camp, and saw countless others die and give up. So what kept him going? Stockdale explained that, "I never lost faith in the end of the story. I never doubted not only that I would get out, but also I never doubted not only that I would get out, but also that I would prevail in the end and turn the experience into a defining event of my life, which in retrospect, I would not trade." He also said, or there's something called this Stockdale paradox, which is a technique to navigating challenging and ambiguous times by combining the ability to confront the brutal facts of your current reality, even as you maintain unwavering faith that you will prevail in the end, no matter how distant that may be. So Stockdale's favorite philosopher, Epictetus, kind of taught this, some things are within our power while others are not. Within our power, opinion, motivation, desire, aversion, and a word, whatever is of our own doing. Not within our power are our body, our property, reputation, office, and in a word, whatever is not of our own doing. So stop and think about what he's actually saying. He's saying that my body, my property, my reputation are not in my power. You may think, like, what the heck does this guy mean? Of course my body's within my power. Of course I can decide to get swole and intermittent fast like Dr. Eslack, or cycle hundreds of miles like Dr. Mundis, until a cancer strikes you down. Unless you are now paralyzed from simply riding a bike like a renowned spine surgeon in Houston several years ago. Unless, unbeknownst to you, an undiagnosed brain aneurysm ruptures. You can do everything right in regards to your health, your reputation. You can try to control every aspect of your life, but ultimately, you just don't control the outcome. So what does that mean for us? It means that we should try to walk through this short life by truly internalizing our goals, but not worry about the outcomes or what's to come next, because that's simply out of our control. On the other hand, our efforts, our preparation, our passion are very much under our control. How many times have we worried about how a patient's going to do post-op, or how that super tough case is going to turn out? Well, as we all know, we can do everything right, like the smoothest ACDF, and a patient still gets a hematoma, or do the sexiest deformity correction and the patient still PJKs. But we acknowledge the problem for what it is and do the best we can. And I think that's the beauty and the lessons of Stoicism. Control the controllables and let the universe take care of the rest. Any perceived obstacle becomes an opportunity for growth. So one of my favorite quotes is the impediment to action advances action. What stands in the way becomes the way. So with that, I guess this is our last conference of the year. And like Mundus was saying, time really does fly when you're having fun. I'm super blessed to have trained at this program with an awesome group of mentors and an even better class of co-fellows. I got a lot more gray hairs than this picture in the lower left. When we were at the ISSG Fellows course, literally actually a year ago. But despite the gray hairs, I'm a better surgeon for it. It's really been an incredible year of learning this craft, and I've had a lot of fun doing it. So with that, stay classy, San Diego. This is the class of 2025 signing off.
Love it. That was awesome. That was awesome. So, what's a thought I had? You're earlier in it, you said where Stoicism only focuses on, so like the guy, the general, was it general?
Yeah, Stockdale, Admiral.
Admiral. So Admiral Stockdale, is he like a legend in your world? Yeah, that's really cool. So being in its concentration camp, right? Like this concept of Stoicism is interesting in that scenario, because what he's holding on to is that the story is not over. There's something at the end.
Yeah.
Right. Which is an uncontrollable in the world of Stoicism, but it ends up being what drives him. For instance, there's no way he can control the future, right? And in theory, if we go back to the dog behind the car, he probably should have succumbed to his environment because he was destined, in some ways, the car was this concentration, the prisoner of war camp that he was at, right? That's torturing and beating him, right? The path of least resistance is to die.
Yeah.
Right. The path of least resistance is not to fight. He was fighting.
That's right.
And so it's interesting when you think about it, because it's not just a singular car, right? And that's where the analogy kind of breaks down a little bit, because what kind of got him through that was faith, which is in some ways, very different from Stoicism, because Stoicism focuses on this finite point of me, versus faith decides to say that there's something bigger than me that is going to be more valuable in some way, shape, or form. And that ends up being what he clings on to, which is in some ways, and I'm not a self-proclaimed Stoic by any means, but kind of goes away a little bit from the teachings of Stoicism. Right. So it's just an interesting way of sort of like when you think about it. That guy Anthony DeMello in that book Awareness, he breaks that down and says like Stoicism is incredibly important, but it does have an endpoint where it falls short. But I think this is like so important as you guys go into practice, like just having this concept of what you guys are doing every day and the dangers of it. I think the other good examples are actually like fighter pilots or SEALs, stuff like that are very mission oriented. I love, I'll be talking a little bit more about quarterbacks too this weekend, because there are very few professions that actually on the regular do what we do. And I would even say quarterbacks probably don't touch it either, right? Because like in the most productive season, in the longest season, quarterbacks played 19, 21 games. What's the number of games now? About games, right?
20, yeah.
So, but it's every weekend. So even half the year they're not playing, right? Y'all are going to be working, probably arguably 47, 48 weeks a year, where it's like the grind is day in and day out, where your performance and your games that you're playing don't have a break. Yeah. And I think that's where we differ from the athletes, and a little bit more like SEALs or these guys that are just constantly have to be ready on the go, to be prepared, and have to be mission ready all the time. And then when they can recover, they need to recover. And I'm sure you can speak a lot more to this than I can, but
You're doing great.
what's that?
You're doing great.
That's what I love about, the SEALs have this. So the difference on the SEALs is that you don't see many SEALs out there that are active at the age of 60. Yet we're still out there operating. And so we are in a very, very unique field where the demands upon us are unrelenting. They just don't stop. And for some, that is overwhelming and they succumb to it. And for others, that ends up being motivating and energizing, So, and this has a lot to do with, like, how do you stay energized in this field that has every day is a little bit of a beating, So
That's a great point.
I hear your thoughts.
I had a question for you. A lot of what Stoicism is born in is following natural law, like you had, talked about. And you had mentioned that, it's more active than passive, but, there are components of it where it feels like it's easy to relinquish control and kind of just flow within what's happening. How do you kind of envision fighting against that within your practice and applying more of the active principles of Stoicism, like, being confident and, taking fault, but also like supportive and not overly like applauding and stuff like that? Like, how are you going to apply that, I think, to like your practice and in your career?
Yeah.
Without transitioning too far away of like, well, this is just what it is,
Right. Yeah. I think it kind of goes back to the sympathy or interconnectedness. I mean, just remembering, we're all a team, but not, like you said, not being too passive and relinquishing control to everybody else, but remembering the concept of extreme ownership. And ultimately, when the patient's on the table, it's all on me. So I think being active in that sense of constantly taking ownership and seeing how I can make things better in my practice, how can I make things better for the patient, and always taking steps to be either more efficient, get better outcomes, whatever it may be. I think that would be a more active role.
I really like how you said that, because this really was an awesome talk to summarize kind of what Tim and I gave, like Tim being like a leader, then like being like the mentor. Like, this really is like bringing that all together.
Yeah.
So this was awesome.
Yeah.
Yeah.
What do you think? Do you have any thoughts?
Can I make,
Yeah.
I wanted to just make one quick comment, Gautham. I really liked it as well. And I read that Ryan Holiday book, The Obstacle is
Yeah.
the Way. And
Right.
like there's all these like bullet points, like these like frameworks you're supposed to approach life with. And it's hard because like you read a whole book and you don't remember everything. But the one thing, as far as, and I'm obviously no accomplished Stoic, I think that's pretty safe to say. But the one thing that has helped me a ton, and it's pretty simple, is like when I have a complication now, I just say to myself, all right, like this is an opportunity to be a really good doctor. Because everybody's like a great doctor when patients are doing great, right? Obviously they're doing great. So that's like kind of a given. But when I have a complication, like approaching it that way, like this is an opportunity to be like the obstacles away, that I could be a really good doctor because something hasn't gone right. And that has been like just one takeaway from that book that I had that's been really, I think, helpful for my mindset. So I just wanted to share that.
Yeah, I love that, Dr. Malone, because that's actually kind of goes to my favorite quote. The impediment to action advances action. What stands in the way becomes the way. And you may think what stands in the way, i.e., whatever the obstacle may be, the complication or whatever, is going to stifle you. But in reality, you can use it as a way to really grow and get better and just do big things that way. So yeah, well, Dr. Malone, I love that. Yeah. All right.
Hey, Yusuf, I was asked that question, like what I thought about that. That was awesome, by the way, Hanny. I think that is a really, really, really good way to interpret that book. Because I think a lot of people would lean into it on the technical side a little bit more, right? And they would say, okay, how do I be a better surgeon?
Yeah.
But you said a critical thing, which is like zoom out a little bit further. At the end of the day, we are physicians and we care for people.
Yeah.
Like it's not just caring for the guy on the table, which obviously looking back at the case and doing an appropriate evaluation and debrief and figuring out what went wrong and what you could have done do better next time.
Yeah.
Really, really important. We're not taking away from that. But what Hanny just said is the way to affect the human and all those other humans that are with that patient is to actually step up and be a doctor. I love that, Andy. That's really good. So I just left the room so I could grab a pen and paper so I could write it down. That's really, really good. And I think like not forgetting that our profession is not, we're not surgeons, we're physicians first. We're surgeons second. Taking care of people is the primary thing that we do. We do it with a knife, which is different than others. But
Right.
my thought on your thing was like, I like this whole thing's a journey, and have grace. Just have grace with yourselves. I was on my drive this morning. It's so funny. Like, I had like, because I went and got bagels, and so I was up at like 5 driving around San Diego, and I was thinking about like, what do I need to do better? And I was like, why is it that I can get up at 4 a.m. to go ride a bike, but I can't get up at 4 a.m. to go read or spend some time on my own just to have a moment where my favorite things were to sit outside with a cup of coffee and just let it be quiet. Like I love it. But man, but 4 o'clock to get on a bike, that's like normal, right? So why can't I do that so I was like, even this morning, I was like challenging myself, okay, like how do I maybe make it 4:15 or 4:30, give myself a little bit of grace, but then try to build that back into my routine, where every day I'm doing the same thing. And for me, that's one thing I'm going to probably change starting August 1st, because like I always like these New Year's because they kind of challenge me every year. But I would challenge you guys, like, don't worry about the whole thing. Just kind of worry about one thing. And like, once one thing becomes a habit, then you can kind of move on to the other thing. Does that make sense? Like, you take all of it, it's a little bit overwhelming. It's like, okay, I'm not going to, like, I can't do it all. But you can do one thing, So maybe that's the.
Greg, what time do you have to get in bed to make that viable? Like, just out of curiosity. For you, like, what time do you have to be in bed?
I say 9, which invariably I'm asleep by 10 or 10:15.
Yeah.
But yeah, I probably need to start saying 8. But then I will likely.
I know. I mean, that's
I will
just not
likely end my
probable.
marriage.
That's just not.
So like,
Kids are asleep. All right, good night.
It'd be like your spouse to be on the same timeline. That works great.
and unfortunately, my spouse would, and I think that would be the problem. Like,
It's like, oh, we're riding together.
oh, actually, that'd be awesome, actually. Yeah, I think that's probably. There's a book called The One Thing, really good book, and it's written by an Australian guy. But that's kind of what he talked about. It's like you do one thing, and then after you do the one thing, it kind of becomes sort of habitual. The amount of brain power it takes to do that one thing, it just goes. It just kind of goes in the background,
Right.
and then you can add another one, right? It's like. And you need to do things that he was talking about, like he would put like these sticky notes in the morning. Just so, hey, Handy, you mind? You got it. You put these like sticky notes just to be the reminder of like whatever you need to do throughout the day, just to remind him of the one thing he was supposed to do. He would just kind of leave himself all these reminders. And thankfully now we have like all kinds of stuff that like helps us with it.
Yeah.
And then like once you make that habit, then you can create another. And you will find that over time, like the amount of like good things that you introduce in your life, like overwhelms everything else. And all of a sudden, like it actually says it also takes less time over time to create these new good habits that you have. And habits are for a season, right? Like when you have young kids, like you can't do the same thing you can when you have kids that are older, right? I couldn't, I can go to bed at 9 when my kids were really young, but then my kids got to this age where like they wanted to talk at night. I'm like, oh, but they come in at 10 or 10:30 or 11 and they spill their beans about their day and their friends and their challenges and all. Like, do you like, sorry, I'm shutting down, 'cause I got to get up, or do you sit there and you listen and that's where you have to like reassess your value scheme, right? Like what's most important. And that's like really hard. So I've been thinking about all these things because it's like, is it okay if I keep talking or not?
Yeah.
Right? So like, if you think about, so I love cycling, right? So if I want to be at my peak performance in cycling, like I love it because it is like, there's an equation for it. Like it's time in miles, right? If you do time in miles and then you add a little bit of resistance training with it, you will get there. Like, I mean, you will get stronger and stronger and stronger, right? And it's like it's prescriptive almost. So if you don't do it, then you won't get there, right? And so last night I decided to go on a ride because I wanted to in the morning, but then we had like my daughter's a friend on her volleyball team's mom just died. So we ended up having to go to a funeral service in the morning, and then things got knocked around, and it messed up my schedule. Right? But so then you got to move things around. And the reality is, like, I was able to shift that day to make it work. But there are plenty of days where I cannot ride because there is a more important thing that goes ahead of that. So when you think about peak performance, you say, okay, well, there's my cycling, which is here. Then there's, like, say, my practice, which is here. And then there's, like, my life, which is there. And you have to be willing to concede on all these different layers, which is, like, really hard, honestly. It's, like, really hard. Because there are times where the practice actually takes over your family, right? And it has to. Like, if you have a complication, you get something go wrong, if you can't make it to the basketball game, you can't make it to the family event. There are times where it's like, it is what it is, because that patient just became more important than anything in the world, like anything, even more important than your child at that moment, right? So, and if you think about that, like if someone's bleeding on a table and dying, and then you hear that your kid just got in a car accident, is in the ICU, you're not going to the ICU. It's a crazy thing to think about, but you're not leaving that patient to die on the table, right? You're going to go save that life. So in those orders, you kind of, if you think about it, it's like, all right, I have these things that are really important to me, but then I have to also realize what is my scheme of importance, because they always talk about this work-life balance, but it doesn't exist, right? There is no balance. If you take, if you put family on that scale, it goes like that almost every time, right? There is no, so the scales, you can't use the same scale for these different things. So I think being aware of those things are really important. And then allow them to shift around a little bit. There are seasons where my practice is easy and I can go really work on a bike. And there are seasons where it's not. Like the last 10 days I've been out once. Like there's a rough 10 days. And I feel the itch, but I've also realized, hey, like what's more important right now? And I have to remind myself of that and say, okay, this is the reality is, like, this takes precedence right now. So I think defining it, writing it out. This guy shares a lot of it. He's always thinking about these things. Yeah.
It is. You're saying it's in my mind.
I think the other analogy that I like, comparing, like when you have like family practice, the things that are important to you, so cycling or whatever else, is the other analogy versus the glass balls, rubber balls, and knowing which balls you can drop and which balls you can't. So bounce. So when you have glass balls, you cannot drop these balls. Sometimes that's the patient that's on the table. I think I like your comparison of like kids. I'm eventually going to have my own patients, and there could be an event like that. And I pray to God that never happens. But the ICU has that glass ball. You've got the glass ball that's on the table. Your workout is just going to have to bounce. But I think that's also like another good way, especially as a parent. So I think some of you are working on that maybe, but being a parent on top of trying to be a surgeon is like a whole new layer of complexity. But I think that analogy was then another mom surgeon actually explained, like gave me that one, and it was very, very helpful to try and like understand, like, she's like, sometimes your family does get to take priority, sometimes that patient, and right now in this moment, this is what you need to focus on, and know that other people have those other glass balls and they're holding them for you. So just kind of
that's really cool to think, because it's still, you're not taking the value away from the family as a glass ball, because it is a glass ball. But what you're saying is, I am allowing someone else to
hold that ball.
That's really cool. I like that a lot.
It's coping mom skills. Mom yelled, check. I think the other thing that so I went to Naval Academy, and the Naval Academy has the Admiral Stockdale Center, which is associated with the leadership department, and I worked in the leadership department background. But the Stockdale Center and all that he was in terms of the things he accomplished and his like coming back background wise is in the combination, I think, of faith and as your point of like Stoicism has an end, and faith is kind of for many people, and we see this also in a lot of the research of mindfulness, is where Stoicism ends, or where a lot of sense like we need something else to hold on to, and whether you have faith in nothing or something, like there's a reason there's 1,001 different religions in this country, is people need that other thing to hold on to that's outside themselves. And so when you don't have that tangible, we often like within like a lot of faith cultures, we'll talk about like you can't see it, but you can feel it. And I love the analogy of like you can't see the wind, but you can see its effects. And I think that that's kind of where the Stoicism and the faith for Stockdale kind of comes in. Is like you need these skills of Stoicism provides you, but it doesn't mean that they exist in exclusion to faith or vice versa. I think that all of these things work together very much so in to balance who we are. I think the SEAL component was also an interesting person. To being a surgeon. So SEALs, special forces in general are like these highly performing teams, but they're highly performing teams for very specific, very finite moments, actually more like a quarterback, but they have these huge support systems in order to make that happen. Where you look at your baseline Marines, your baseline Army, your baseline Navy, they don't have those massive support systems. Those officers are more like you guys in that they are constantly grinding because they don't have the same level of background support system. They're just working with a regular team all the time. Not taking anything away from special forces, they do great things, but it's a little bit different. And I think that a lot of people outside the military community don't appreciate that as much. But like I think a fighter pilot's a better comparison, where they have their ground team, they have people taking care of the maintaining their aircraft, but they are the ones flying the jet and day in and day out, and they get ground down more. And they have to be conscious about their sleep hours and everything else they're trying to do to maintain those skill sets and be on that edge to fight that airplane. So I think that might almost be a better comparison. So I think about how much of a team it does require to get every patient from a clinic to an OR safely into rehab, getting them through rehab to get that best possible outcome the entirety of the course of care.
Yeah, because the fighter pilot's there for a finite piece. It's not the whole mission, right? Same with the surgeon is like you might be directing part of it, but then we're doing that like critical piece. But then once that's done, it's like there's other parts that have to go into.
Somebody else is taking the aircraft and making sure it's maintained overnight so flying back there.
That's cool. What else? We're just chatting. We have a few minutes before the other fellows come. So like, if y'all have something to add, please feel free to, or we're just kind of hanging out, having bagels.
Well, this is Kama. I think this is awesome, Greg, that you guys talk about this Stoicism. I think the only thing I would add is how important that time in the clinic is. Because surgeons, we all love to operate. You all love to look at scans and fix things, but each of these patients has such a story, and spending that time in clinic sometimes where the financially it's a lot easier to go in and operate on something, yet spend 45 minutes on someone. You're trying to explain to them why a different pathway is better. That time is also incredibly valuable, even though we all enjoy being in the OR. That spending that time knowing that story, getting that history, getting what's important for that patient is incredibly important.
Thanks, Com. I don't do it all the time, but like one of the things that when I can is like I like while we're exposing or doing something, I always like to tell a story about the patient. Like just kind of just passively sharing, like, I don't know, maybe something I learned about them in the clinic setting, or because it kind of provides that humanity to what we do, right? We're operating on people that have a belief system, that have stories, and that have their own faith journey, that have their own families, and something in them at the age of 78 leads them to think it's a good idea to have a deformity surgery. It's like there's, those patients are not like, they're the true warriors, right? In it all. Like, I mean, think about people that are able to overcome.